Welcome to the Heart of Melbourne Cardiology Quick Q&A. Number 3. Atrial fibrillation and heart failure management with Dr Logan Bittinger.
It's increasingly recognised that atrial fibrillation is very common in patients with heart failure, and there can be a chicken or egg effect, as in heart failure causes atrial fibrillation, but atrial fibrillation can also cause heart failure. So it's important for us to determine what the key feature of an individual's illness is to allow us to coordinate and manage their condition long term. We have an increasing repertoire, increasing number of strategies to manage atrial fibrillation in the long term, and these can be either non-invasive involving medications or invasive involving new techniques called ablation. We have a lot of technologies that allow us to accurately diagnose and look for triggers for atrial fibrillation and to actively influence and remove those triggers to help restore regular sinus rhythm and improve heart function. Some key research that was performed in Melbourne showed the key link between heart failure and atrial fibrillation and the benefit of restoration of sinus rhythm, as well as the effects of ablation with maintenance of sinus rhythm and long-term improvement in ejection fraction. At Heart of Melbourne, we are proficient in all techniques for evaluation and management of atrial fibrillation in heart failure, including multiple different strategies and techniques for ablation. The actual techniques for ablation are a bit too complex for a simple discussion, but our cardiologists at Heart of Melbourne can discuss this with you in detail and can decide which strategy is optimal for you. Not everybody is best served by a procedure. We are also proficient in full evaluation and management of non-invasive strategies for managing heart failure as well.
What is the role of devices in heart failure management?
There is an increasing role for devices in management of patients with heart failure. A lot of patients with heart failure will develop atrial fibrillation. Some of these patients may be suitable for invasive ablation therapies, but a lot of them aren't due to chronicity of disease or other factors. In these patients, if we're not succeeding with simple medications, then sometimes pacemakers can be useful. Atrial fibrillation has a significant impact on heart failure by causing tachycardia, but also by causing dyssynchrony, and this can be corrected with pacemaker devices. We have several different types of device that can be utilized. Most commonly, we will use a device that will prevent bradycardia and allow more active medical therapy, but quite often we will go ahead and ablate the AV node to deliberately put the patient's heart under control of the pacemaker, and in this situation we need more specialized devices that provide more physiological pacing, either with left ventricular leads or new techniques involving His bundle pacing or left bundle area pacing. At Heart of Melbourne, we have trained in all these techniques and we're able to perform all the procedures required, including both the device implantation and ablations. Each patient needs to be looked at individually, and their individual situation needs to be assessed when deciding whether a device can be useful for them. Multiple clinical trials have recently shown the value of control of rhythm in patients with heart failure and the improved mortality in patients receiving biventricular pacing and having AV node ablation. And this has been a key turning point in our strategies for managing heart failure patients with atrial fibrillation.
What members and roles are involved in the cardiology team?
When we are managing our patients with heart failure, we are a member of an entire team that is involved behind the diagnosis, the evaluation and long-term generation of management strategy for our patients. The cardiologist is the central figure, but we also employ imaging analysis, rhythm analysis, nursing specialists, and educators to help give a holistic approach to what is a very complex condition. There are complex pharmacological requirements, and the monitoring and following up of these is often more complex than we cardiologists can monitor. And we utilize our heart failure nurses to help provide the ongoing care and support that our patients require. Most of our patients require regular imaging and updating of their ventricular function and their volume status, and this is provided by our imaging specialists. Quite a lot of our patients also require evaluation of coronary status and rhythm analysis as well. So at Heart of Melbourne, we offer a complete service and a complete team. We have specialists who are expert in all areas of heart failure management, ischemia management, rhythm management, as well as a dedicated nursing team to help allow the coordination of management for our patients.
What's involved in heart patient evaluation?
The evaluation of arrhythmias can be very challenging and often needs to move beyond a simple ECG or a simple 24-hour Holter monitor. The history, of course, is key, but we often need to use more fancier dedicated tools. With the evolution of technologies, we now have devices that our patients can carry with them, such as watches or devices on their iPhones, but we also have dedicated actual heart-specific devices that we can supply from Heart of Melbourne that a patient can take home to help monitor their arrhythmia. Beyond that, we can undertake specific procedures to evaluate their arrhythmia, specifically an electrophysiological study, which is a diagnostic study that specifically allows us to interrogate the patient's intrinsic electrical system. It might sound quite confronting to the patient, but it's actually remarkably simple and straightforward in experienced hands with extremely low risk, simply requiring 2 or 3 punctures in the femoral vein and electrode catheters to allow us to record the heart's natural rhythms and perform diagnostic studies. With complex arrhythmias, we often struggle to capture them on monitoring, and this is where the role of electrophysiological procedure comes in. We usually undertake these procedures in patients who have significant symptoms, such as incessant palpitations, breathlessness, discomfort, or syncope. Each patient needs to be looked at on their individual merit, and a decision needs to be made based on their clinical scenario.